This is a story from 2 days ago from the Irish Mirror. Elderly woman's rare autoimmune disorder linked to Covid-19 vaccine, doctors say. Notice the comma here, and it's because we start with the object and then we get the subject, and that's doctors, and the verb, which is say. Yeah, you could rearrange the sentence, couldn't you? And you could say doctors say that elderly woman's rare autoimmune disorder is linked to the Covid-19 vaccine. And notice that to make it a whole sentence, we do need to add some auxiliary verbs. They very often drop out the auxiliary verbs. They leave out, they omit the auxiliary verbs in newspaper headlines in the same way that they omit the and a. They omit the definite and indefinite article in newspaper headlines. Let's carry on. The 78-year-old was coughing up blood. Now, if you cough something up, it comes up from inside of you. A little bit like we say throw up for vomit. We say cough up if you and it comes out of your throat. This poor lady, this poor 78-year-old, was unfortunate enough to be coughing up blood when she attended University Hospital Galway, and it was 2 days after she received her second dose of a coronavirus vaccine. Here's the hospital. So, a 78-year-old woman developed a rare autoimmune disorder that resulted in respiratory failure 2 days after she received her second dose of a Covid-19 vaccine, a new study has found. And once again, we get the comma because we start with the object, and then we get the subject, a new study, and then we get the verb, has found. A new study has found that a 78-year-old woman developed a rare autoimmune disorder that resulted in respiratory failure 2 days after she received her second dose of a Covid-19 vaccine. The woman was coughing up blood when she attended the emergency department at University Hospital Galway, as well as exhibiting a fever and shortness of breath. That means that she wasn't breathing properly. She was breathing in very small amounts, and she kept gasping for breath. That's what it means when you have shortness of breath. She was initially diagnosed with a lower respiratory tract infection, but when she continued to cough up blood, further tests revealed evidence of a rare, very rare, autoimmune disorder. The patient was diagnosed with vaccine-mediated anti-glomerular basement membrane antibody, anti-GBM disease, or Goodpasture's syndrome, which creates antibodies that attack the lungs and kidneys. She was treated with steroids and had 7 plasma exchange sessions, as well as receiving medication to suppress her immune system. This resolved her respiratory failure and restored her kidney function. Well, I'm very glad to hear that. The authors of the study, who are doctors from the Department of Nephrology at UHG, said the rollout, now a rollout is when you launch something, and the rollout of the Covid-19 vaccines, that started in March 2020, and it was mandated to many groups of society. The rollout of the Covid-19 vaccines had shown promise in altering the course of the pandemic. However, they added that reports have documented vaccine-associated adverse effects. Adverse effects are side effects, adverse reactions, including cases of kidney injury in some individuals following vaccination. Although rare, these vaccine-associated events warrant continued monitoring to better understand potential mechanisms of kidney injury linked to vaccination. They wrote, "It is important to maintain a high index of suspicion and test for anti-GBM disease in patients receiving SARS-CoV-2 mRNA vaccination. Anti-GBM disease causes antibodies to attack capillaries in the lungs and kidneys, causing pulmonary hemorrhage and inflammation of small blood vessels in the kidneys. The doctors opted against, that means they chose not to, the doctors opted against taking tissue samples from the 78-year-old patient, but they noted in their research that analysis of such samples could provide valuable insights into vaccine-associated organ effects. They noted that a very rare cluster of anti-GBM disease had been reported during the Covid-19 pandemic, but they believed that this had not previously been linked to vaccines. Our case provides support for a potential association between the BNT162b2 mRNA vaccine and onset of anti-GBM disease. Pharmacovigilance of COVID-19 vaccines will be important. So stay vigilant, guys. If you've had a COVID-19 vaccine, stay vigilant to determine the incidence of this potential adverse event, they wrote in the study, which was published in the latest issue of the Irish Medical Journal. Okay, that's it.